Atrial fibrillation is one of the most frequent causes of stroke, and patients who have atrial fibrillation are more likely to come back with recurrent strokes, which are often more severe and more disabling.
Of all the specific causes of stroke that are out there, the one that we have the most effective treatment for is atrial fibrillation. If you anticoagulate a patient who's had a stroke, you can reduce their risk of another stroke by somewhere between 60 and 80%. No other treatment in the whole stroke world comes that close to that level of efficacy. And the strokes that you prevent are some of the worst strokes that people can have, the disabling ones, the ones that land people in nursing homes, the ones that a lot of patients fear even more than they fear death. So finding atrial fibrillation allows us to initiate a treatment, anticoagulation, that's remarkably effective.
The Crystal AF study has greatly impacted my clinical practice as it demonstrated that implantable loop recorders identify atrial fibrillation in patients that otherwise would have not been able to have been diagnosed, because 79% of those patients do not actually feel the atrial fibrillation. The Crystal AF results were also replicated in real-world studies, and that further drives my clinical practice. And I try to get these monitors implanted expeditiously so we can identify the patients that are at the highest risk for stroke from atrial fibrillation.
In 2019, a number of researchers in the journal Stroke published an article entitled "Prolonged Cardiac Rhythm Monitoring and Secondary Stroke Prevention in Cryptogenic Stroke Patients." And they showed that there was an increased incidence of AFib detection with a risk ratio of about 2.5, anticoagulation initiation about 2.07, and a decreased risk of recurrent stroke by about half. And the confidence interval ranged from 0.2 up to 0.97. So it was statistically significant in all three of those domains. So a very important study, and it's just some preliminary evidence showing that there is a potential impact of prolonged cardiac rhythm monitoring on secondary stroke prevention in cryptogenic stroke patients.
Long-term monitoring with an ICM in stroke patients becomes really important because, first of all, you don't always see the arrhythmia or the AFib right away at the time of the stroke. So we have a lot of good data to show that, when somebody has a stroke, we don't actually find that AFib sometimes until months later. So it can be missed on a 30-day or a 2-week monitor. So number one, you want to monitor long enough to make sure you actually find out if they have arrhythmia. And number two, if you do find that arrhythmia, you then have to start managing that arrhythmia, either with antiarrhythmics, anticoagulation, something. And so the long-term monitoring becomes very useful for that as well.